To improve healthcare outcomes, the world needs innovation. And who better to deliver it than nurses, the people closest to patients each day?
Nurses have 99% of the answers to fix healthcare and improve outcomes. So if we collaborate and we ask the whys, why are we doing this? Why should we be doing this? I think we will transform healthcare.
Nurses have been innovating healthcare for decades. Haines herself was inspired after reading a study from the Joint Commission Center for Transforming Healthcare that found a link between uncoordinated closing activities and risk of wound contamination.
When you're in the moment where you're counting instruments and you're trying to close out that procedure, the last thing you want to do is to have to babysit the field to make sure that they've changed their gloves, they've switched instruments, and so color came to mind.
To better coordinate and standardize closing activities, Haines developed Ready, Set, Close, a surgical kit that uses green as a visual cue and ensures consistent aseptic technique.
When they're transitioning from the dirty part of the procedure into the clean closing part of the procedure and you see the green come out, it gives you confidence that they've switched over their supplies and they're following the best practice protocols.
Medline recognizes the innovative abilities of nurses like Haines and actively recruits clinicians to develop out-of-the-box solutions. Their creative thinking and healthcare-oriented mindset is why Haines is just one of more than 100 innovative clinicians who work at Medline.
I'm privileged to work for a company that values clinical input, that really looks for clinical innovation, looks for those things that we can really help with practical solutions, because that's what it's all about.
Find more examples of clinician-led innovation at medline.com.